Data serves as a bedrock of high-performing health practices. Meaningful data helps to identify areas for change and makes room for honest, objective discussion. It allows clinics to monitor the impact of their quality improvement efforts, and it allows clinicians to identify patients in need of additional care. It is important to not only collect data, but also to share it in a timely way and use it to drive improvement. Some ways that clinics have shared data include putting up data displays, enabling providers to do individual searches of clinical data, or sharing data at meetings. Teaching residents how to interact with the data they receive is a key part of clinical education. Residents can be overwhelmed by the amount of data they receive and need guidance on how to integrate it into their practice. Residents can use individual practice data to identify areas for improvement. They can engage with the rest of the clinical team to plan and monitor about quality improvement initiatives.
I just got a report for hypertension control rates in my panel. It looks like only 58% of my patients are under control.
Yeah, so tell me more about what you think of that.
Well, it seems low to me. I wonder if there's a problem with the reports.
You know, a lot of people get really surprised when they see the report, as a lot of my preceptors used to say, all of my patients are doing well except the ones that I don't know anything about.
Okay. Well, I see it's not much worse than the clinic average, so maybe this is just as good as this population will do.
Yeah, it's true. So your number is really close to the clinic average at 65% or so. And that's one of the metrics that we have selected for our clinic because we really feel like this is the place where the team can come together and improve the care of our patients. Do you know anything about what the clinic is currently doing to help improve that number?
No, not really. I think I might have got an email about it, but I didn't read it carefully.
Yeah, so it's really hard to keep up with emails when you're on your rotation, so completely understand. One of the things that will show up is that you will see that we're systematically repeating blood pressure for all of our patients who have high blood pressure when they come in, especially when you room them. So let's look at your data, okay? And do you see whether it's been done consistently or not?
Yeah, actually, it looks like I haven't been doing my rechecks.
Yeah, so remember, you don't necessarily have to be the one to actually do the recheck for your patients. This is the place where I would start talking to your medical assistants about it. So my recommendation is tomorrow when you come in to huddle for your clinic, huddle with your medical assistant and you can talk about how together you're going to recheck blood pressures to improve the rates for your patients. And remember, for super complicated patients, there's another resource. You can actually go and refer your patients to the pharmacist who can do medication titration for your patients. Have you done that before?
Oh, no, I didn't even know you could do that.
Yeah, so the pharmacist is actually down the hallway. So what I would do is let's go finish seeing this patient and then introduce yourself to her so that both of you know each other in the future. And the nice thing is that if you ever have one of these patients in the clinic while she's in clinic, you can do a warm handoff so that she can see the patient on the same day.
Oh, okay. Sounds good.
All right, great.
High-performing practices identify meaningful measures and share those measures frequently and at the level of the individual clinician or team. Clinicians and staff strategize about ways to address low metrics and share promising practices across teams. By teaching residents how to identify and align their work with clinic-wide data initiatives, we are equipping them with the knowledge and experience to become practice transformation agents in the future. To summarize, preceptors can teach residents how to interpret data, encourage residents to regularly review their data and objectively use this data to identify areas for improvement and to track this improvement, and help residents understand wider clinic data and how to align their work with these initiatives.